Good evening, everyone. For this presentation, I will be presenting the basics of the disorder sickle cell disease. Sickle cell disease is a hemoglobin disorder that is genetically inherited, and it affects millions of people today. Sickle cell disease is most prominent in families whose ancestors came from countries such as those in sub-Saharan Africa, as well as Mediterranean countries such as Greece and Turkey. You can see a map of where it mostly occurs right here to the right. The disorder sickle cell disease is caused by the mutated form of hemoglobin known as hemoglobin S. Hemoglobin S, under low oxygen conditions in the body, tends to cause red blood cells to change from their normal round biconcave shape to a sickled shape. Hemoglobin S is also much less effective at carrying oxygen throughout the body, and sometimes those sickled cells can get stuck in small vessels. Sickle cell disease is the result of a mutation in which an adenine base is exchanged out for a thymine base. This causes the amino acid glutamic acid at position 6 on chromosome 11 to not be translated, and instead a valine amino acid is translated in its place. This can be classified as a point mutation, a missense mutation because only one amino acid in the sequence was changed, as well as a transversion mutation. This is a transversion mutation because we see that one purine was exchanged out for a pyrimidine base. The HBB gene sequence is responsible for ensuring that the protein beta globin is made in the correct fashion. Beta globin is an integral part of the structure of the entire hemoglobin molecule. So normal hemoglobin is made up of two sets of dimers, and when they fold correctly, they exhibit the final quaternary shape of hemoglobin in its correct fashion. Each dimer is composed of one alpha globin and one beta globin. Each of the four subunits, two in each dimer, are bound to a heme group that is surrounded by a porphyrin ring that you can see over here in the structure to the right. You can also see that iron is at the center of this porphyrin ring, and iron is responsible for allowing the cooperative binding of up to 4 oxygen atoms when hemoglobin is in its normal form, which is hemoglobin A. But once the mutation has occurred, hemoglobin S will be translated instead. The results of this one mutation cause the hemoglobin molecules themselves to change shape, and then they cluster with other hemoglobin molecules. The reason for this is that changing out that glutamic acid, which we know is negatively charged or acidic at physiological pH, for a valine that has an R side chain that is hydrophobic, allows that valine to introduce new van der Waals interactions which were not there before. These van der Waals actions are hydrophobic, and they are responsible for clumping the hemoglobin molecules together. These hemoglobin molecules do still have an affinity for oxygen and will transmit some oxygen to tissues to a certain extent. However, when the hemoglobin molecules within the red blood cells reach the tissues of the body, they are encouraged to offload oxygen at low pH. Once they offload the oxygen, then the mutated hemoglobin causes the red blood cells to sickle. Then they cannot pick up extra oxygen, and they often get caught in small blood vessels such as capillaries, and therefore they deprive tissues of adequate oxygen. When red blood cells sickle and get caught in vessels within the body, this mainly causes the signs and symptoms of sickle cell disease. These symptoms are often seen in infants as early as 6 months of age, and then they progress and get worse into adulthood. Not having enough oxygen to certain tissues of the body constitutes anemia. So the most common symptoms of anemia include lightheadedness, fatigue, and pale skin color. Sickle cell disease patients may also experience delayed growth, vision problems, as well as severe and sudden pain in the chest or lower back. These sudden pain attacks are often called pain crises, and they last varying lengths of time. Sickle cell disease not only causes red blood cells to change their shape, those red blood cells are then destroyed sooner than they normally would be. This causes enlargement of the spleen, jaundice, and frequent infection. Organ damage, strokes, and even premature death may result. Sickle cell disease, again, is inherited, and it is inherited in an autosomal recessive fashion, and even though it is not sex-linked, it of course can be passed on to one's offspring. As we have worked many times this semester with Punnett squares, we can see that they can be shown to see how likely it is that offspring of parents with certain genotypes will end up with sickle cell disease. So I have a couple examples shown here. As you can see, if you have two heterozygous parents, there is a 50% chance that a child will be a carrier of a mutated allele, but only a 25% chance that that child will actually have sickle cell disease. Then if we look at the other one over here, if we cross a homozygous dominant with a heterozygote, there is no possibility for a child to be afflicted with sickle cell disease. However, there is still a 50% chance of each child born being a carrier of that mutated allele. So to apply inheritance patterns to multiple generations, I have used the pedigree that I created a few weeks ago for our genetic disorder project. As you can see, all of the red circles and squares represent individuals afflicted with sickle cell disease. I represented the fact that sickle cell disease is an autosomal and not a sex-linked disorder, as there are an equal number of both boys and girls or males and females affected. Of course, we know these proportions can always slightly deviate. Also, not every affected boy or girl has an affected parent, which means that this disease is inherited in a recessive fashion as opposed to a dominant fashion. Most scientists agree that the evolutionary reason that sickle cell disease has persisted in our society is that having one mutated allele for sickle cell disease gives a heterozygote advantage to those who may be exposed to a deadly form of malaria. Generally, malaria is most common in certain parts of Africa, which is why people who live in this area have a higher than normal incidence of sickle cell disease. So having only one mutated allele actually allows a person's body to utilize their macrophages more effectively in getting rid of the malaria parasite. A person having only one allele actually may show very few symptoms of sickle cell disease itself and can live a relatively normal life. However, as we know, if a person has two mutated alleles, then that does not help them get rid of the malaria, and actually the malaria makes the anemia caused by sickle cell disease even worse. In the United States, if you were born post-2006, then you have been screened already for several disorders, including sickle cell disease, by way of a simple blood test like a prick of the heel. That way, treatments that may reduce symptom severity in the future can be started immediately in infancy. If you are an adult who was born before 2006, or you just wish to be tested for sickle cell disease, you have the option of always going to a healthcare provider and having a blood test done in the lab. In a laboratory where they will send off that blood, tests such as protein analysis, electrophoresis, and allele-specific polymerase chain reaction are used to test for the sickle cell disease mutated gene. However, if you might wish to test at home, you can use DTC or direct-to-consumer kits, and they are offered by companies such as Veritas, Pathway Genomics, and Myriad Genetics. They usually allow you to gather your own sample, saliva most times, in the privacy of your own home, and then you send that off. Your DNA is then sequenced, and then further testing can be done on those sequences of DNA to check for mutations that may lead to genetic disorders like sickle cell disease. For example, a test called Carrier Status DNA Insight from the company Pathway Genomics can test for as many as 120 recessive disorders, depending on what you want to test for. However, this test can be quite expensive if you test for a lot of disorders, maybe up in the range of $2,000. So how do we treat sickle cell disease? Currently, most sickle cell disease is being treated with medications and lifestyle changes. There are 2 medications currently on the market, hydroxyurea and L-glutamine, that work to decrease the number of pain crises a patient may have. These medications do unfortunately have many side effects, and doctors recommend that patients taking these medications drink lots of water, avoid high altitudes, so no flying, and then also avoid any type of strenuous exercise. Another option for a sickle cell disease patient, especially an adult, is a bone marrow transplant, which means you must have a willing and compatible donor. A splenectomy may also need to be performed even in children because there is undue stress placed upon the spleen in destroying those extra red blood cells, since they are destroyed faster than they need to be, as well as fighting frequent infections which are common with sickle cell disease. So to manage the symptoms of anemia, frequent blood transfusions are also often done, and they are recommended. However, frequent blood transfusions are also very risky, as an excess of iron in the blood can lead to organ damage and failure. So here is just a conclusion of the topics that we covered, and I hope you guys learned a little bit more about sickle cell disease, some things that you didn't know. I hope you enjoyed the presentation. Here are my works cited page, all of the sources that I used. And I just want to say that I very much enjoyed the genetics class this semester. I enjoyed working with you guys as well as with Dr. Stansel, and I hope you guys have a great holiday season. Thank you.